If you have never had therapy ever, or you're thinking about it, or you had a bad experience with therapy before, and now you're thinking about whether you should go again, this video is for you. I am not a therapist. I have no degree in therapy, but I do feel like I want to share some of the experiences that I had with this therapy. And there are three things that I want to share with you about therapy. Three things. The first thing, you need the right therapist. The second thing, you need the right type of therapy. And the third thing is that therapy will help. So, I'm Katie Anderson and I am 42 years old. I am in the over 40 elder millennial category of life, and I am getting way outside of my comfort zone and talking about a lot of things. And this is sort of me just purging this information and hoping that some of it might help somebody and hoping that it will help me to get this out. So, hi, thank you for being here. I'm going to talk about the three things that I'm thinking of when I think about therapy and things that I kind of wish someone had talked to me about or that I knew about before I got into therapy. I have a very loud chair here, so let's get into it. So the first thing, number one, you need the right therapist. I think that sounds kind of obvious, but I want to dig at this a little bit because sometimes you can have a therapist that is not right, and you do not realize that it is not the right fit. And there's a lot of things that go into choosing the right therapist for you. I think that everybody's a little bit different when it comes to what they're looking for in their counseling, in their therapy, and things like that. But coming from the end of someone who dealt with a trauma, there were some very specific things that I needed. These specific things might not be necessarily what you need, but I do want to kind of go through these because it might be something that helps a little bit. So the first thing for me, because I was someone who had gone through a trauma, it was really important for me that that person is a trauma-informed therapist. And I learned that that is actually a thing. And when you look at the different therapists' backgrounds and you look at the different things that they specialize in, if you're someone who went through a traumatic event, whether it was a childhood trauma or it was an assault, like what happened to me, or anything of that nature where it was dealing with some sort of a trauma, you want to make sure that you have a therapist who is a trauma-informed therapist. That means that they have a background and training and understanding in not just, the things that you went through and the things that you need from them, but it also has to do with how they communicate and the space that they put you in when you're going through your sessions with them. And having a trauma-informed therapist is so important if you're going through kind of working into that space of how do I get through this? How do I deal with these trauma and get through that? I had never been to therapy in my life. I had never been to counseling. I had never done any of that. I actually had a really unhealthy perspective. It's embarrassing, the perspective that I had on mental health and on therapy and on all of those things prior to 2018. If you would have asked me what my opinion was on, for example, depression, I would have said to you, why can't people just choose to be happy? Like, it's a choice, just choose to be happy. I was so wrong. And I'm almost embarrassed. It's not like that's something I'd shared with everybody. That was sort of just like a personal opinion that I had, but it's embarrassing to me that I felt that way. And to be honest, I felt that way because I had never suffered from depression. I had never experienced it. And even though externally I had heard about depression and I knew that people had this happen and there's clinical depression and there's acute depression and all these things, I did not understand it. And I think I came from such a place of, mind over matter and, what you focus on, you will be, and all of these stupid things that I used to believe like so intently. I really did not understand that sometimes it's just hard. And sometimes depression is so real and so raw. And the fight that someone's having go on underneath the surface is so deep. I had no idea. And until I was deep in it myself and I understood what it was like to lose complete interest in everything, and to not want to get out of bed, and to have everything feel heavy and painful, and to cry out of nowhere for no reason, and all of these things. If you would have come to me, 8, 9 years ago, I would have been like, buck up, buckaroo, like, what's wrong with you, and that's embarrassing. And so when you're dealing with some of those things, so for me, going into therapy, going into it, I had no idea what I needed. I just knew that there was something very, very broken and wrong and hurt in me following this assault. I was a night and day, totally different human being after that. I was a shell of who I was. I went from being out and excited and happy and driven and all of these things to literally through the entire month of September, I did not leave my room. I had people bringing me food for my family, and I was extremely depressed, and I was suffering to a great, great deal. And so I realized very quickly that I needed help. Because it was being pushed so fast into something that was so completely different than anything I'd ever felt. And I would say, in my life, of course, I've had ups and downs. I've been sad. I've been happy. You have breakups in life, right? I had never felt the way that I felt in that period of my life. And it dragged for years for me. And so all I knew in that moment is that I need help to cope with this so that I can survive. Not talking about the fight that I was in legally and the attempt to try to get justice and all of those other things, just survival, just attempting to make it in the day-to-day. I needed therapy. But I didn't know who to go to. I didn't know who to talk to. I didn't know any of that. I literally pulled open Google and was looking up therapists, not knowing what to look for. And when I went in, I went to 3 therapists that were not the right person before I found the right person. And the way that I knew they were not the right person, I'll kind of explain that right now. But some things I knew going into it. I knew that based on what I was needing to work through, I could not have a male therapist. I was having a hard time just being around men at all, other than my husband and my child. I was having a very hard time in any sort of proximity to the male species. And so I knew I certainly wasn't going to feel comfortable having a male therapist. So that did narrow things down for me at first, right? Because I knew I'm going to find a female therapist. So that kind of narrowed that a little bit. The first therapist, I just looked someone up. They were close proximity to where I was and geographically. And so I went there. And I remember, because it was like I was traumatized from this experience, I went into this therapist's office and, like, talk about sunshine and daisies. Literally, they had flowers everywhere, and it was like the waiting area was just so positive, and like positive affirmations on the walls and all these things. And I came in there most likely in sweatpants and a hoodie, just no makeup, just feeling horrible, hadn't seen anyone outside of my immediate family. And I'm sitting in this waiting room, and I remember they gave me an intake form. And this is pretty normal, pretty standard. So I fill out this intake form. And as I'm filling it out, I'm my name, that was an easy one, my birthday, things like that. Then it started asking some questions. And these questions in this intake form, you'd think would be pretty easy questions, right? And I wouldn't describe myself as an analytical person. I'm definitely an overthinker, but these questions were rating the question, like you have to answer by circling in sort of, multiple choice kind of a manner. And I couldn't fill out the form. And I remember that the questions that were hard for me I think the reason they were hard for me is that because I was really having a hard time with the fact that I knew I was suffering and that I had a mental health problem going on, and I didn't want to have that. There was a big part of me through this entire process that was angry that I was going through these things, these you know, these problems mentally and emotionally, I was angry about that because I had never felt this before. And there was so much blame I had on the things in my life from that assault that I was angry about it. And so when the question came up on this form that said, how often do you think about unaliving yourself? And then the choices were unaliving. I heard that you do that on YouTube. You don't say the word suicide. So I heard that you say unaliving yourself. But so self-harm, right? So the question was, how often do you think about this? And it was a pretty general question. And I looked at this and I struggled because it was asking about how often in the last 6 months, right? So the choices that you had to circle were either, every day, once a week, once a month, rarely, things like that. And I was struggling because over the course of 6 months, it would have been almost never. Over the course of those 3 weeks, it was constant. So my answer would be very high on this question, right? But I had trouble with it because even though my answer was very high right now, in this immediate moment, I was thinking about these horrible things all the time. But over the course of 6 months, no, right? Because a month ago, 2 months ago, 3 months ago, I was never thinking about them. So I would skip that question and I left it blank. And then I went to the next question. I kind of put a little mark there because I was going to ask her about it because only I am the person that's overanalyzing the intake form on a therapy session. Of course, my first therapy session. So then I get to the next question and it was similar. It was questions about how often do you feel sad, right? Over the last 6 months, how often? And again, only now was I feeling these things. So I'm looking at this form and I struggled with this form. You guys, I struggled with this so much that I literally was skipping questions. And so I go into the session, right? And I feel a sense of, I'm going to have some control over this because I'm going to go into therapy, not knowing how therapy works, not knowing what the process is. And I'm going to take control of this meeting. I was treating it like a business meeting, right? I'm looking at therapy in the way of, I'm going to sit down and I'm going to tell them what I need. And I'm going to pull out of them what I need from them, and I'm going to heal myself and I'm going to be okay. Like, there's not really any book that I've come across yet that tells you how to do therapy right, because there probably isn't a right way to do it, right? So I went into it and I remember I sat down and I had this form and she's like, nice to meet you, I'm so-and-so. And we sit down and I said, before we started, I just had some questions about the intake form. And she's like, okay. And then I started talking through it and I'm explaining, I don't understand how I can do this. I don't think I can answer this question. And she said to me, I'm going to need you to answer it. And I just remember feeling pushed into this corner where I was going to have to commit to saying that over the last 6 months, I think about harming myself all the time and every day. And that's not the case. This has only been recent. This is not who I am. This is just what's going on with me right now. And so I felt pressured. I felt pushed in a corner. I felt that there wasn't a safe space for me to express why this was hard. As I say all of this, I think I might not have been the easiest patient, but that's a good self note there, right? But I just remember I had that one therapy session and I went home and I said to Jason, I said, I don't know how to do therapy because I don't think I can go back. So I tried another therapist, and that second therapist didn't have the same intake problem, understood that I wasn't comfortable with certain questions, understood that I didn't feel comfortable going into exactly what had happened yet. It was too fresh. It was too hard for me. But I didn't feel connected to that person. I didn't feel like I wanted to talk to them. This is the second person that I had gone to. So that person just wasn't the fit. I just didn't really like them. Right? So the first person I thought was kind of unprofessional. The second person, I just didn't like them. And then I had my third therapist. These are all different organizations. They didn't pass me around or anything. So I go to the third therapist, and with this situation, and this, I don't know if I was wrong in feeling this way. And I think it was because I was trying so hard to figure out who's the right person for me. But this person was so young, very, very young. And I didn't feel like they would understand all of the things that I was going through as a wife and as a mother and as someone deep into their career who is now mourning the loss of their career and all of I didn't feel like there was enough life experience for this person, for me, being someone that's, approaching 40 and things like that. And I don't know if that's a fair statement or not. I really don't know because, every therapist was in their 20s at some point, right? But that just made this person not the right fit for me in that moment, right? So now we're like batting 0 for 3 at this point when I decided to look into an organization someone had told me about called the Blue Bench that is it's a nonprofit organization specifically dealing with trauma and assault survivors. And I reached out to them and I talked to them, and very quickly in the intake process, they took me in for what they consider an intensive triage experience where I was very quickly immersed into a very regular schedule of sessions. And for a certain period of time, that was my therapy. And I remember that I felt really positive about that person. I felt that I could tell that they were trauma informed. I could tell that they knew how to talk to me. I could tell that they knew what questions to ask. I could tell that they were not going to push me when I had even sort of the body movements that were going on that were like reflecting where I was in a lot of this stuff. And I felt that that's a safe place for me. And, this particular therapist, her name was Amy, and it was going so well. And then all of a sudden we got through this period of time. It's like an 8-week triage period or whatever it was. And then she told me, okay, we're going to need to transition you to another therapist because we're out of that triage emergency period of time. And I cried. I was so devastated because I felt like I was maybe starting to make progress. I felt like things were starting to move forward. And then all of a sudden I have no therapist again and I have to start all over again. And I'm imagining the intake girl and the lady I didn't click with and the girl that was too young. And I'm just thinking this is going to be a nightmare. And that's when I was introduced to my therapist I had for a number of years, Janice, and she was amazing. And I really, truly feel that a big part of what you need in therapy is that first thing, which is making sure that you have the right therapist. If you go into therapy and you do not feel that connection, you do not feel safe, you do not feel that it's a place where you can go into these things that are so painful and hurt so much, it's not the right person. And I think you have to be okay with that and just don't give up and find the right person. So the first thing is you need to find the right therapist. Don't give up until you find the right therapist. So we'll get into all the therapists I had after that and other things later on. But the first thing is find the right therapist for you. The second thing is you need the right type of therapy. And, again, going into therapy, I had no idea what to expect or what it's about or how therapy works or anything. I really had no idea. I feel like that's sort of the theme of all of this with me is I've lived in this little bubble in my life, apparently. And I had no idea about so many things. So if you are like me and you've never had therapy before, then we'll continue forward. So there are a lot of different types of therapy. And if you want to get a lot of the science on it and all of that stuff, definitely Google it, watch a psychiatrist's channel or something. But I'm just going to give you some of my experience. One of the things that I really appreciated with my years of therapy was the multiple kind of types of therapy I was exposed to. And part of this was because I really wanted to get better. And, I think I had sort of an unhealthy perspective at first because, when you think about school or you think about studying for a test, you think I'm going to study, I'm going to put this work in, I'm going to take the test, and then I'm going to pass it, right? And that's sort of how I've thought about a lot of things. And, I'm going to get into the insurance industry. Therefore, I'm going to study, I'm going to put in that learning and that work, I'm going to take a test, pass it, and I'm good to go. And unfortunately, I think I sort of went into therapy thinking Before therapy, I was great and I was fine. I was assaulted and now I'm in therapy. I'm a mess. So my logic was, I just need to make sure I do all the things you need to do and check the boxes and do the work and do what I need to, and then I'm going to be fine. And I've learned that that is not exactly how it works. Holy smokes, it's night and day. Where I am now, where I can have this conversation with you on my computer screen, I can have this conversation with you right now, and not cry. I can have this conversation and not feel panic attacks coming on. I can discuss therapy. I can discuss anything, even in the ethos, in the universe relating to what happened to me, and I can keep my shit together. This is not the way things were for me in 2018 and 19 at all. I could tangibly list the things that I knew if I even get close to talking about any of these things, I will have a breakdown. And so what would I do? I would just avoid all of those things, right? So in therapy, sort of as I kind of got started with therapy, the very first type of therapy that I was exposed to was CBT, so cognitive behavioral therapy. So some people describe this as talk therapy. That's very, very watered down explanation of it. But basically, for me, I think this was a very good starting point when it came to therapy. And I was really in a cognitive behavioral therapy type of mode for a while, because it allowed me to separate myself from the trauma and from what was going on to kind of get to a more analytical analysis of my behaviors and understanding what is in my own control, and having these conversations with a therapist that was give and take, and, talking about my day to day and going through, because for me, it was a sexual assault at the workplace. So everything in my life triggered me. Anything that had to do with work, if it had anything to do with that person who was still by proxy associated with the company, if it had anything to do with the fact that people had heard things about what had happened, but I was not allowed to talk about it, if it had anything to do with the detective calling me, or the lawyers, or anything at all dealing with any of that, I would be just in a constant state of high anxiety, panic attacks, like triggers, just constantly. I did not want to be diagnosed with anything. And maybe I'll kind of get into a lot of that stuff later, but let's just go to the types of therapy for right now. So cognitive behavioral therapy for me was very helpful because it allowed me to really have a sounding board, who's trauma informed and very well trained on understanding, how the behavior that we go through every day and what we do and how we react to things, trying to analyze that, try to put yourself in a safe space. So a lot of things that I learned through that was a lot of it had to do with coping. A lot of it had to do with understanding and identifying the triggers for me, which I really feel like triggered is such an overused phraseology nowadays, but boy, do I understand it. Because there are very specific things that it is literally like a gun trigger. When something of that nature is brought up, I will immediately feel my body heat up, my body tense up. I will feel my breathing change. I will feel pain in places. I will feel myself having my almost like I've described to my husband, like I can't control my hands, right? Like I'll have these things happen. And this was heavy in 2018 and 2019. And so it was so important for me during that CBT period of time that I was learning how to handle triggers, because I certainly wasn't going to be able to just lock myself up in my room and never see any other humans. I wasn't going to be able to just, quit my job. I was fighting to try to stay moving forward. That's what I was trying to do. And so after a period of just complete isolation, I was really trying to get back into my life despite all of this mess swirling around me. And so with this, it was identifying what are these things that trigger me, and therefore understanding that, recognizing it, and then saying, what do I do about that? because some of it you can't control. I can't control what someone says. I can't control, something that happens to be on TV that hits me the wrong way. I can't control certain things that are going on, but I can learn to control my reaction and things I physically do to help myself in those situations. I learned so much about things that I still to this day do to help lower that panic mode that happens. Things, and I'm not talking about medication yet, but things that deal with, let's say, understanding box breathing, understanding how to breathe and control my breathing and what that will do to calm myself when I am starting to lose it. I'm understanding, different things that I can do physically with my hands or with my fingers, or how I can position things in my body, or understanding, let's say, there were certain things. It's funny. I almost think of them like how someone who has like a kid with ADHD or something has fidget spinners or something, but little things that you can have that you are able to hold on to and put your thumb in a certain place and squeeze a certain way. And, all of these little things, these tools that I learned helped me so much. I had so many of these things on my person at all times. There were things like understanding that you can be pulled out of a triggered state when you have, let's say, a smell that you can then smell. So I'd have, let's say, lavender oil that I would be able to dab onto something that I was holding, and I'd be able to, in a meeting or whatever the case is, have it in my hand, and I'd go like this, and I'd be able to smell this smell and calm myself, right? It is amazing the amount of things that I learned that I would bet you, maybe I'm wrong, but I was in meetings with dozens and dozens and dozens, sometimes hundreds of people, and no one knew that I was on the brink of suffering with some of these things. And I had these tools to help me with this. So many things. I started to focus on understanding mindfulness. This came kind of right through that process of that talk therapy and that cognitive behavioral therapy, understanding how, kind of going outside and what the sunshine can do, and grounding techniques. I mean, all of these things I learned. I knew nothing about this stuff. I'd always enjoyed writing, and I've written for many years, but I was able to channel a lot of journaling habits into tools that would help me with my mental health as I was going through this. Being able to cope with stressors that were extrinsic and what to do. So that first area when it comes to types of therapy, for me, that was a huge help was that cognitive behavioral therapy and understanding things like, triggers and coping methods and, breathing techniques and meditation and journaling and all of those things. So all of these tools I learned over this period of time. Another type is experiential therapy. And so EDMR, I always kind of get my orders on that. Eye movement, desensitization, and reprocessing, which was a very interesting type of therapy for me, where you are literally trying to program your brain through a process that's very effective. It was actually very emotional for me. And I'd actually like to find another therapist to help with this, but through a process. Sometimes they do this where they have almost like a little kind of buzzer that you're holding in your hands, for example, that kind of moves from side to side. Sometimes your eyes are closed and you're moving your eyes from side to side. Sometimes there's different things they do while you are getting guided through this process of especially when dealing with something very, very hard. And the point of it is to get you to a place to be desensitized to your physiological reaction that you have to these triggers. So that was a very interesting type of therapy for me to experience. I was blessed to where my therapists I had for the longest amount of time, she also had an entire additional degree in art therapy, which was basically, she would guide me through processes where some of our therapy session would be through guided meditation or guided therapy in art therapy, where, through color expression and through drawing and through all of this stuff, she'd guide me through this process, understanding compartmentalization, all of that stuff. So I feel like, they talk about art therapy, they talk about music therapy, they talk about all of these different things, interpersonal therapy, additional talk therapy types. There's so many things out there And I do think that very first step for me, that CBT, that cognitive behavioral therapy, was definitely like the biggest impact as far as being able to cope and be able to get my day to day back where it needed to be. But I would say, if a type of therapy is not working for you, do a quick little like bit of research and find out what other types are there and ask them. Ask your therapist, do they do anything with art therapy? Do they do anything with journaling? Do they do anything with guided, meditations? Do they do, what kind of therapy can they help you with, aside from whatever it is, it doesn't seem to be maybe working at that time. So like I said, having the right therapist, very important, and making sure that you're having the right type of therapy and introducing those to yourself is that second thing. And the third thing that I think is just really kind of driving home the point of all of this is, if you're in a place where you're suffering, if you're in a place where things are just not getting better, and and I think it's one of those when you know kind of things, at least it was for me, you need help. Give yourself the chance to find the right therapist and the right type of therapy, because therapy will help. Therapy will help. And whether, you figure out what kind of therapy that is, or the right person to do this with, I don't know how I would have gotten through the last few years without therapy. I remember all the different things that were leading up to extremely stressful environments for me. There were times when, I had to go on a work trip and I hadn't gone on one yet. And just thinking about getting on the airplane to go on that work trip, just thinking about going and being surrounded by work people that were drinking and what that would feel like for me, and knowing that I was going to be in an environment similar to the environment that I was in when I was assaulted, that was very, very hard for me. And if I did not have a therapist guiding me through that process and helping me get strong enough, ready enough to do that, I don't even know where I'd be. It's been, 6 years or whatever. And now I'm still in the same industry that I was. I still work with a lot of the people that I did. I travel for work. I go to conferences for work. And I have learned over these years that there are just some things that I need, even now to this day, to be able to cope in those environments. And I do feel very blessed now that the company that I'm with, the safe environment that I'm in right now, they understand that about me. I have never been pressured to drink alcohol when I don't want to. I have never been pressured into a situation that was not comfortable for me. I've never felt unsafe. And, I think that has helped, because that is not the way it is for everybody and everywhere. So, if you're somebody who is going through something, find therapy. I will say, in addition to that in-person therapy I had for a number of years, I have done the phone therapy. I've had therapy on the phone. I've done telemed therapy, where I've had therapy on my Zoom call. I have to tell you though, I did not really like the video therapy and the talk therapy on the phone as much. I really think for me, I needed a human. I needed to be in a room with a human. And again, that comes down to the right therapist, the right type of therapy. And so I think that that's just something important to recognize about sort of where you are in that process. I had for years been very hesitant. I just very, very uncomfortable with diagnoses, right? I did not want to have a diagnosis. I did not want the stigma. I really think a lot of why I did not want a diagnosis of anything, and I did not want to be categorized in a certain place. Part of that was my own head trash and my own issue. But honestly, I think part of that is because I come from the insurance industry. And I think there's a part of my messed up little brain that is like, Katie, you have never been diagnosed with anything. You have never been on medication. You have never been in therapy. If you do have any of these things happen, you are now going to be a person that for the rest of your life, when you answer questions on an insurance form, you will have to say, yes, I suffered from this, or yes, I had to do this. And I swear I did not want that. I was ridiculous. But, all said and done, through this process, I had come to terms with the things that I had to go through. And, I was diagnosed by multiple therapists with PTSD, very acute PTSD. I was diagnosed with depression. I was diagnosed with panic attacks and anxiety. I went through having to cope with insomnia to where I was sometimes not sleeping at all. And sometimes for almost a year, I was maybe sleeping an hour to 2 hours because I was having such tremendous night terrors. My husband and I had to sleep in separate rooms for a period of time because my night terrors were so problematic, to where he couldn't sleep because I would wake up crying or shaking. And, it got to the point where I needed to sleep in another room. And, when you're going through these things, you have to realize, how are you going to do that by yourself? Right. And I think that, there's so much we can pull ourselves out of. Right. But at a certain point, let someone help you. I have so much gratitude for my therapist and what she did for me and the help that she provided for me. And, the things that I learned in therapy, there are things that were great. There are things that are helpful. There are things that I still use today, and I'm still in therapy, and all of that is wonderful. But there are also things that I learned, in going through the process of this federal jury trial I was going through, where I had no idea that my therapy records would be made public. Things like this. There's a lot of things that I learned through this process that were shocking to me, that I'll get into in another video, that were just sort of mind-blowing kind of realizations of what reality was. But I think that, sometimes we just go through a lot, right? And I think that I've been blessed in my life to where, knock on wood at this point, I have not lost a parent. I'm not someone that has lost a child. I'm not someone that has gone through a terrible disease. I have not had to fight cancer. I'm someone that has not had these big things happen in my life. And I feel like, so I, of course, don't understand those things. I had this big thing happen in my life, and this is the one experience I had where I felt completely alone, and I felt completely isolated and horrible and just like a broken piece of myself, And I think that the thing about therapy is that it can help you try to get back to who you are. And, there were times that I tell my husband, like, I don't know if I'm ever going to be the person that I was. I don't know. And honestly, there's a lot of me that is okay with that. There's a lot of me that says, you know what, Katie, you don't need to be the person that trusts everybody. You don't need to be the person that thinks everybody is good, because you know what? There are a lot of people that are not good. There are people out there that will hurt you that you never would have thought would have hurt you. And I think that I am okay now understanding that and never trusting somebody that I shouldn't trust. And, this was a terrible lesson to learn. But, I think that that's something, I have to understand, is that who am I now moving forward? So just to recap, those of you thinking about therapy, I say you should do it. As I've said, we're just going to go Nike on this and biatch, and we're just going to say, just do it. I think you should do it. Find the right therapist, find the right therapy, and therapy will help. Those are my 3 takeaways from this. So thank you for being here. Thank you for hopefully one day being a friend.